Hi, I'm Lauren Massey, physical therapist and board-certified orthopedic clinical specialist. I'm also the owner and clinical services director of Bay Area Physical Therapy and Lafayette Physical Therapy. Today we're going to talk about why physical therapists give a home exercise program. Well, first and foremost, we can't do it for you. We need to make sure that our patients are motivated and involved in their care. You might be in clinic, maybe 2 hours a week when you're in an active physical therapy program where we are watching you and cueing you and holding you accountable to all those things we've taught you. Good posture, how you're walking, how you're moving in your sports, things like that. But otherwise, there's a lot of time left in the week where you can go and mess things up or undo the good that we've tried to impart upon you. So in the beginning of physical therapy, we see the things that you need help with that you can't do and the things that might be contributing to your ailments, and we try to help you learn those better behaviors and break those bad habits. First of all, as we all know, breaking bad habits can take a while. So this might even take a couple weeks to make sure that you're not undoing some of the good things that we know you're working on the side. Also, we need to have you start making the lasting changes to your tissues through the strength and flexibility exercises that we might be issuing to you to make those benefits stay. One thing we do know is that on a cellular level, it takes about 6 to 8 weeks to see strength changes in muscle cells and as little as 7 days to start losing it. That's crazy. So in terms of being consistent with your home exercise program, we're trying to mitigate this and make positive progress. 2 times a week is the minimum exercise to maintain gains and strength in general. We prefer 3 to 4 times, which is also supported by the research, to make gains with your strengthening, and that does include the rest time that's needed in between. So again, if we're thinking about having 1 day on, 1 day off, that ends up being about 3 to 4 times per week that you're doing your home strengthening program. Typically, I encourage my patients to try to do their home exercise program 5 to 6 times a week when they're in active rehab, because I know that life happens and you might miss a couple days in there during the course of the week. I also expect, although unfortunate, that my patients upon discharge are going to be good about doing their programs for maybe the first month or 2, if I'm lucky. Months 3 and 4, they're probably down to half of what they were doing when they were actively in physical therapy care with me. And by 6 months, they've probably totally forgotten about their home exercise program, but hopefully they're back to their normal level of exercise and activity. The problem can arise that if you are one of those people who didn't have a great strengthening program as a part of your daily activity, that 6-month mark might be when things start creeping back in. So before you get discharged, always have that discussion with your therapist on, is this a maintenance program that I'm going to need to do for the rest of my life, or what that long-term plan might be. If you think you need help determining what you should be doing at home, please reach out to a physical therapist today.